Good afternoon. I'm Nick Dirks, and I am very, very pleased and honored to welcome Congresswoman Barbara Lee back to her alma mater, UC Berkeley. Welcome back. And to welcome you all to today's event, Fighting for Health Equity in 2017 and beyond. And who could have thought that this would have been the day that the CBO came out with its report. We knew something like this was coming, but I have only to read the placard in the second row for the numbers that I just actually myself saw, the prospect of 14 million in 1 year and 24 million in 10 years, losing health care in our country. So this is going to be the fight of our time and of this place. Congresswoman Lee is one of our most distinguished alumni, and in her life of public service, she exemplifies what UC Berkeley stands for. The values of equity and inclusion, of speaking truth to power, and indeed of taking on the biggest social and political issues of our time. I can assure you, you will be inspired by the opportunity to listen directly to her and hear from her this afternoon, especially at this critical moment in our history. I think we are all, some of you might have come from a different district, but all of us who are represented by our Congresswoman are proud to have you as our. Congresswoman Lee has been a leader on many crucial issues. Today, of course, we're focusing on health equity, and she has been a champion for health equity since her days as a graduate student here in the School of Social Welfare. All right. And it is indeed the case that at Berkeley we have many of the most important researchers, practitioners, and policymakers focused on health equity. We are all of us proud, and I'm proud as Chancellor, of the work our students, our faculty, and our alumni do in these important areas, linking health problems and social inequalities, work towards equal access to health care, while we confront the structural conditions that lead to poor health for so many in our country and indeed around the world. The Berkeley Center for Social Medicine, the sponsor of today's event, is one of our newest centers on campus. This interdisciplinary center serves as a hub, bringing together students and faculty from various disciplines, along with healthcare professionals and community members who share a commitment to understand and confront the ways that inequality and health are so intertwined. And I can see that by the numbers here this afternoon, how many of you care about the work of the center and the work that we do on campus and the work that our Congresswoman will talk about today. So it's my great pleasure now to welcome Seth Holmes, who's Associate Professor of Public Health and Medical Anthropology, co-chair of the Berkeley Center for Social Medicine, who will tell you a little bit more about today's event. Thank you very much.
Welcome to this event focused on health equity. Can you hear me all right? Great. So I was lucky to meet Congresswoman Barbara Lee a couple years ago in her office here in this district, and then get to visit Congress as part of a briefing on health disparities that she put together with other people from the Tri-Caucus of Congress that was amazing and inspiring, and I look forward to today's event. I'm Seth Holmes from Public Health and Medical Anthropology, co-chair of the Berkeley Center for Social Medicine, along with Professor Charles Briggs here, which is organizing today's event. The center is an interdisciplinary group of faculty and students from public health and the social sciences conducting research and organizing events to understand and confront the ways in which social, political, and economic structures relate to inequalities in health and healthcare. Today's talk is part of the center's Structural Competency Lecture Series, co-sponsored by the School of Public Health, the School of Social Welfare, and Samuel Merritt University. Structural competency is a new framework for understanding and responding to inequities and discrimination in health and welfare. And we hope you find this event and the rest of this series interesting and energizing in this very important historic moment. Please visit the Berkeley Center for Social Medicine website for future events and more information. I'd like to thank Chancellor Nick Dirks for his opening remarks, as well as recognize the following special guests. Vice Chancellor for Equity and Inclusion, Naila Suad Nasir. Dean of the School of Public Health, Stefano Bertazzi. Dean of the School of Social Welfare, Jeff Edelson. And the Director of the Institute for the Study of Societal Issues, Martin Sanchez-Jankowski, who's in the back. And finally, from Samuel Merritt University, Shirley Strong, the Director of Diversity. So please turn off your cell phones. After Congresswoman Lee speaks, we'll have an opportunity for question and answer. In order to get to as many questions as possible, please write down your questions and send them to the end of each aisle. People will pick them up and we'll try to put them into organized groups.
Can you fix the sound, please? The sound is terrible.
Someone will be working on that, yes. If you know people who weren't able to make it today but are interested in today's events, or if you want to share it in some way, Representative Barbara Lee's Facebook page, which is Rep Barbara Lee, is live streaming this event, and you can like it or share it or tell other people about it. Now I'd like to welcome Professor Denise Hurd, Director of the UC Berkeley Program in Health and Social Behavior and active member of the Berkeley Center for Social Medicine, to introduce Congresswoman Barbara Lee.
Can everyone hear me? Great, thank you. Well, I am just thrilled beyond words. It's such a pleasure and an honor to be on the stage with Congresswoman Barbara Lee. She's a personal heroine of mine, and I think of anybody interested in fighting for social justice and equity. In the side room in our little reception, she reminded us that we just have to keep going. We've faced these times before, and we have to follow in the legacy of those that were working with the Underground Railroad, that were pushing against all kind of barriers, that we have to keep going. So Congresswoman Lee is a trailblazer. She's contributed to this fight for justice in so many ways. So I'm going to briefly highlight a little bit of her career, and you can see that she has truly lived her values. Congresswoman Lee was a single mother raising 2 sons. She attended Mills College and was on public assistance while building a better life for her family. She received her master's degree, as has been noted, in social welfare from our own UC Berkeley, so she is one of our prized alums. Even while a graduate student, she was already working in this area. She founded the Community Health Alliance for Neighborhood Growth and Education. The Alliance provided mental health services to many of the East Bay's most vulnerable populations. From 1990 to 1998, she served in the California State Legislature, and in 1998, she was elected to serve what is now California's 13th Congressional District, including Berkeley. Congresswoman Lee serves on the Budget Committee and the powerful Appropriations Committee, which oversees all federal spending. She has long advocated for legislative action to end poverty. In 2007, she worked with a diverse coalition of members of Congress to create the Out of Poverty Caucus. In 2013, she became chair of the Democratic Whip Task Force on Poverty, Income Inequality, and Opportunity, and she is the former co-chair of the Congressional Progressive Caucus. As a psychiatric social worker, so she's bringing her training from Berkeley into her work, Congresswoman Lee is dedicated to ensuring that everyone has access to affordable and high-quality health care, especially the most vulnerable. Congresswoman Barbara Lee's main healthcare focus, and I can attest to that because she's been to the campus many times to talk about these issues, is always on eliminating health disparities and achieving health equity, especially for racial and ethnic minorities. Since her time in the California legislature, she's been a fierce advocate for ending HIV and ensuring an AIDS-free generation. Since entering Congress, she has authored or co-authored every major piece of HIV legislation that's been reviewed. She served as the chair of the Congressional Black Caucus during the drafting of the Patient Protection and Affordable Care Act. And she's worked to ensure strong provisions that expand healthcare access, address health disparities, and create incentives for people to live healthy lives. Currently, she is the co-chair of the Congressional Asian Pacific American Caucus Health Task Force. Please welcome me, please join me in welcoming Congresswoman Lee.
Thank you.
Well, go Bears! Good to be home. Denise, thank you so much for that very humbling introduction, and also for what you're doing here at our university and for your tremendous leadership. Really appreciate it. And I just have to say to Chancellor Dirks, thank you so much. I really am happy to be here to see you and the whole team who have put this together. And just say to Seth and to all of those who have put together the Center for Social Medicine, this is such a far-reaching, visionary department. What do you call it?
Center?
That center. It's a center, not a department, but it's a department to me because this is really a center whose time has come. And it's very, I think, important for people throughout the country to recognize what you're doing here, because if we're going to address healthcare in the most comprehensive way, you've got to look at the social determinants of healthcare and what did you call it, the structural competency as it relates to healthcare. So I just want to congratulate you and everyone who have put this together and for inviting me to be with you today.
Thank you.
Of course, we're here today to address the urgent need in terms of one of the most important issues in our society, which is, one, inequality, but yes, inequality of health. And I want to remind you of what Reverend Dr. Martin Luther King once said. And this is Dr. King's quote. He said, "Of all of the forms of inequality, injustice in health is the most shocking and the most inhumane because it often results in physical death." So, as you heard and as you know, I focused my life really on promoting social, political, and racial justice, providing access to health care and creating a society that promotes health, healthy living, community health, individual health, prevention of disease. That's a really fundamental component of working for social justice. And yes, I was a student in Mills College when I actually got very involved in politics through the first African American woman elected to Congress. That was Congresswoman Shirley Chisholm, who made me register to vote. She insisted and ended up, I was going to flunk a class where I had to do field work, and said no, flunk me, because I wasn't going to work for McGovern, Muskie, or Humphrey. They just didn't relate to what I thought a young African-American woman on welfare with 2 kids had, could relate to. And so she made me register to vote, work in her campaign, and bottom line is we took about 8% of the vote in Alameda County. I got an A in the class and went on to Miami, Florida, as a Shirley Chisholm delegate. So that's the beginning of my political life. But I share that because at the same time I was working as a community worker with the Black Panther Party. And the 10-point program of the Black Panther Party was extremely important, still is. They actually were the inspiration for free breakfast programs for children. And they established the George Jackson Free Clinic. And it was through working with the Black Panther Party and the George Jackson Clinic and all of their programs that I realized the fact that healthcare is a basic human right, but that there were so many people who didn't have access to healthcare. And so they encouraged me, and I worked with them, and then came here to the University of California, the School of Social Welfare, Jeff, and I want to thank the school here for giving me the opportunity to study and to understand the role of social workers, especially in politics. I went through the clinical track, and so I thought I was going to be one of the best clinical social workers, psychotherapists in the world, but I somehow ended up doing what I'm doing. But it comes in handy, dealing with what we're doing. It comes in very handy. But as Lee said, I started a community mental health clinic right out of Haviland Hall because I didn't see the existing mental health services as meeting the needs of low-income communities and African-American communities, because I believed then that, and this was through my practicum and through my field work, that strictly psychoanalytic psychotherapy was not going to get it when you were struggling to find a job, didn't have any money for daycare. Well, yeah, you're depressed. I'm depressed because I can't figure it out. So you need to have a little bit more in terms of your own personal emotional needs. You have to have advocacy. You have to have a system, a support system. And you have to have people who are going to be advocates, not only for yourself, but for structural change, so that we could change the conditions that give rise to a lot of the difficulties that I saw as a student learning my practice of psychoanalytic psychotherapy. So that was my start here, and I really thank my alma mater for giving me a chance to be a little radical and to start my own community mental health center. And it worked for 10 years. It survived for 10 years. So it was relevant, and it was very important, a very important statement to say that mental health should be part of our healthcare system. It should be about community mental health. So now in Congress, we're at this crucial moment where we continue to debate the future of the Affordable Care Act, which really has been the single most fundamental effort to improve our nation's health system since the founding of Medicare under President Johnson. And as we conduct this debate this week, it'll be before the committee I'm on, the Budget Committee, and I'll be thinking of Dr. King's words, which have never been more relevant. And the stakes have never been higher for most of those impacted by health disparities. So let's look at the situation that we have faced very briefly historically, and then talk about some of the specific improvements that we made in health equity through the passage of the Affordable Care Act. And let's look at what's at stake with the proposals for repealing this law. Now, where we were prior to the ACA, which only fully went into effect in 2014, you know the common refrain about lifetime and annual caps, pre-existing condition exclusions, additional costs for women, and the exorbitant costs that were borne by countless individuals driven to bankruptcy for the sheer bad luck of having a catastrophic health condition. Actually, being a woman in many states constituted a pre-existing condition, and your rates went up. Being a victim of domestic violence constituted a pre-existing condition, and you sometimes could not even get health insurance because of that. The inequality among different groups that existed under the previous healthcare system were enormous. A report published by the Alameda County Public Health Department in 2008, now this is just before the ACA was adopted, found that an African American child born in West Oakland was 1.5 times more likely to be born prematurely or with low birth rate than a white child born in the Oakland Hills. That same child was 7 times more likely to be born into poverty, 2 times more likely to live in a rented home, and 4 times more likely to have parents with a high school education only, or less. As a toddler, that child was 2.5 times more likely to be behind on their vaccinations, and by the 4th grade, 4 times less likely to read at grade level. That child will reach adolescence living in a neighborhood with 2 times the concentration of liquor stores and fast food restaurants. In the long run, this child was 5.5 times more likely to drop out of school and significantly less likely to attend a 4-year college compared to a white adolescent living in the Oakland Hills. As an adult, the child born in West Oakland will be 5 times more likely to be hospitalized for diabetes, 2 times as likely to be hospitalized and die of heart disease, 3 times more likely to die of a stroke, and twice as likely to die from cancer. And after a life of struggle, that African American child born in West Oakland can expect to die nearly 15 years earlier than a white resident born in the Oakland Hills. So let me be clear. People with money, people living in the Oakland Hills are living longer, healthier lives, much healthier lives than people living in the Oakland Flatlands. This is one of the clearest examples right here at home of the health disparities and inequities that we are facing, and it also demonstrates the depth and the complexity of this issue. And we know that there are no silver bullets or simple solutions to solve these problems. As we can see from this example, and this is all over my district, all over the country, health inequity is much more about access to health care and health insurance. It's about safe housing, it's about safe streets. It's about clean air, clean water. It's about access to fresh, nutritious food, quality education, and about financial and job security. Addressing the social determinants of healthcare, this is critical to addressing racial and ethnic disparities and closing the gaps. So structural competency is extremely, extremely important if we're going to provide health care for everyone and give everyone a shot at the American dream and to live long and healthy lives. Some of the on-the-ground work here in the East Bay, though, is phenomenal. Some of our clinics are doing wonderful work. I'm on the advisory board of the Ethnic Health Institute that has been around since 1997 to expand opportunities for community outreach and coalition building to promote health and chronic disease prevention in minority populations. Formerly a community service program at Alta Bates Summit Hospital, EHI currently partners with Samuel Merritt University to bring together doctors, medical practitioners, and concerned members to the community to improve health education, inform people of color about health issues specific to them, and connect those populations to resources in the community. The East Bay Asian Local Community Development Foundation does unbelievable work. The Street Level Healthcare Project, and I'm citing some of these, the Health Access Program, for students here who really want to get involved in a lot of the preventive aspects of social medicine, and also in terms of just direct service. There are many, many great organizations in my district who I would hope you would visit and get to know. Let me just share a personal story with you about this in terms of my own family. I was born and raised in El Paso, Texas. And we lived in a community. The population of El Paso is only about 2% African American. My family, my grandfather migrated there, so we were one of the 10 black families in El Paso. So my mother and her 2 sisters were born there. Myself, my 2 sisters were born in El Paso, but primarily the black population comes from Fort Bliss military. Okay, so we lived in a community where we had, it was a fairly, I won't say integrated community, but there were many Latino families in the same community, many immigrant families. Okay, fast forward to today. My sister has multiple sclerosis. My mother passed away from COPD. 90% of the people who I was raised with in my neighborhood are dead or really very, very ill. And I tried to figure out what was this about. And I heard a story once on NPR about El Paso, and I remember this now. Smelters, the huge smelters that were pumping out this toxic garbage in our community for years and years and years. And I have not seen any studies in terms of the correlation between this, but I can bet you one thing. The high incidence of deaths and diseases in my family, in my community, and where I lived was directly related to the environmental injustices and the health difficulties and problems that came from having that smelter right in my community. And so they never would have cited that in a wealthy community, never. And so environmental justice and climate change and all of the issues around our planet is extremely important for the health and safety of people of color in terms of closing the inequities and many of our gaps that still remain in health access for people of color and in terms of prevention of diseases. Now, I was privileged to be the Congressional Black Caucus chair during the negotiations around the Affordable Care Act. I pulled together what we called the Quad Caucus. It was the Black, Hispanic, Asian Pacific American Caucus, and the Progressive Caucus. And we said, we've got to get together because we want single payer. We want a public option. So we went to the president, and we met with President Obama several times, conference calls directly with him, and he was very supportive. He said, okay, but show me the votes. Couldn't quite get the votes, but we said, well, we have about 100 votes who won't vote for this if, in fact, we don't do the following and have the following provisions in. And so I'm really pleased that what we were able to do, though, because of that, we were able to put in strong provisions as it relates to health equity and health disparities. And we expanded the Office of Minority Health. We actually, and I have to read you some of the agencies we put together to make sure that the social determinants of healthcare were addressed in the Affordable Care Act. 6 agencies: the Agency for Healthcare Research and Quality, the Center for Disease Control and Protection, Centers for Medicare and Medicaid, Food and Drug Administration, Health Resources and Service Administration, Substance Abuse and Mental Health Services Administration. So the ACA also elevated the National Center on Minority Health and Health Disparities at the National Institute of Health from a center to a full institute. The National Institute on Minority Health and Health Disparities, which really reflected an enhanced focus on minority health. Once again, the social determinants of healthcare were really considered as we put together the Affordable Care Act, and that's at risk now. And so understand why some of us are standing so strong against no repeal of the ACA. Bottom line, we are not going to repeal it. Millions of Americans were able to obtain health care. People with pre-existing conditions are no longer locked out of the health insurance markets. Again, being a woman, no longer a pre-existing condition. Young adults are who are looking for work or going to school, of course, can stay on their parents' insurance up until they're 26, and also people are no longer forced into bankruptcy after a serious illness. This is a major deal, and here in California, we had the highest population of uninsured individuals in the country, at nearly 5.8 million without coverage. Here in California, we ended up now, I think we're at about 3.74 million people who can get health care coverage as a result of the ACA. Because we expanded Medi-Cal, we also added an additional 1.5 million who are enrolled in Covered California. So this is a big deal. The rate here in California without health insurance came down from 17.2% to 8.2% in 2015. That's a big, huge drop. And one of the community clinics, La Clinica de la Raza here in Oakland, wonderful clinic. I met Jane Garcia when I started Change Incorporated. And so this clinic has done unbelievable work with patients in the Fruitvale and throughout the city and the county. La Clinica's rate of uninsured fell from 47% in 2012 to 23% by 2015, while the rates of patients who had Medi-Cal coverage increased from 42% in 2012 to 70% in 2015. So this is major. These numbers represent real people. They represent real improvements in the ability of low-income and minority communities to begin to access the types of medical services that have been long available in more affluent and advantaged communities. So the bottom line is that these changes are not only improving people's well-being, but they really are. The Affordable Care Act really, it's saving lives and closing that life expectancy gap with people of color, as I mentioned earlier. So, the repeal of this Affordable Care Act, and I'm glad that the Congressional Budget Office came out with their, as I'm sure Donald Trump is saying, bogus numbers that are fake, but they're real, believe me. CBO came out with their numbers. By 2018, I think, if in fact we went along with what they proposed, we'll have about 14 million more uninsured. By 2026, I think it's about, what,
24 million.
24 million. Overall, it's about 54 million who will be uninsured. Whereas the Affordable Care Act, if we kept it just as it is, and that's not to say it doesn't need tinkering and some parts of it fixed. If we kept it the way it is now, I believe we would have 28 million under the current law. Yeah, 52 million uninsured under the GOP plan, 28 million now. People will lose their subsidies. Medicaid, which is Medi-Cal in California, would stop as of 2020. You'd be on your own. Tax credits. The wealthy would receive the tax benefits from these cuts. Insurance premiums will go way up. Benefit packages will go way down. Low-income people and middle-income people will not afford to be covered anymore. That's the bottom line. And so we have got to continue to raise our voices, continue to speak loudly, clearly, continue to be part of these town meetings, which we had one yesterday, and my district is leading the way, I just have to say. Leading the way. They want to defund Planned Parenthood in the ACA, which we're not going to let them do. Some of us remember the days of back alley abortions and lack of access to women's health care. They're trying to cut mental health treatment in terms of eligibility under the Affordable Care Act. That would be totally gone, and we've been fighting so hard for mental health parity for so long. And so this is just something that cannot happen. And I'm really pleased that here you all get it, and you all are working really hard to really not only learn about this complex healthcare system, which it is, and I'm surprised that Donald Trump didn't know it was complex. And I told the press that I thought that was kind of ignorant, because my grandkids, when we were negotiating it, they knew, my little grandkids knew, because they'd call me up and I would try to explain what we were doing. It's really difficult. It was really hard. So everybody knows how complex this is. Everybody knows. So I really believe that we believe here, and we will continue to say and raise our voices, that healthcare is a basic human right, that yes, Black lives matter, and that we will close these gaps. So thank you again. Thanks for having me here.
Thank you. And if you can turn on your mic. So the first question actually comes from Gibson, who's one of our wonderful student reporters from the Daily California. Did I get your name right? Okay. And the question is, what can the audience do? What can students do to support you, and what can the students do to support health equity? What can they, community members, faculty, students, staff who are here, do in the fight for health equity?
Well, I think what you're doing here today, learning more about the Affordable Care Act, is extremely important. Also, what's important is to organize, mobilize. These town meetings are really having an impact. And I guess I can't get too political here, so I won't say what you need to do. But you know what you need to do. But in the meantime, just organize, raise your voices. Your voices are being heard in Washington, D.C. I mean, right now, there's a pretty good chance that we may be able to stop the repeal with Rand Paul and the Freedom Caucus and the extreme right wing not supporting it for their own reasons, which are terrible, but they don't support it. And then us who don't support it. So continue to let your members, if you're from out of town, let your members of Congress know where you stand on it.
Yeah.
Right now, the mobilization and the fact that people are out there organized, democracy is working. The power of the people, as the Black Panther Party used to say, is what is important. And so just continue to do the grassroots organizing and mobilizing around that. And just know that you have many members of Congress who are doing the same thing with you. We're doing our inside and outside work to make sure that we defeat this.
Thank you. These are actually sort of emotional questions to read for me, interestingly, but the next question is, if Trump Care becomes law, what can we do to protect people at risk of losing access to health care and their own health?
Well, I don't call it Trump Care because he does not care, and you. He does not care. No way. No way. And so, of course, our fight is to make sure we don't repeal the Affordable Care Act. But states, and we negotiated this in the Affordable Care Act bill, states can opt to do their health care system the way they want to do it. If, in fact, we wanted single payer in California, that would be. If we wanted a strong public option, so then Medicare for all. But, right now, it's do not repeal or take away 30 million, the health care of 30 million people. Don't make America sick again. And that's where we are.
Thank you. The next question from Heather Flett in Berkeley is, how can we citizens support you in keeping the ACA strong and investigating Russia?
Thank you very much. Well, every day something new comes out on Russia, and I think keep raising your voices and calling members of Congress. Ask them, first of all, to push for this independent investigation. You have all Democrats on as co-sponsors. Sooner or later, the Republicans are going to have to come out and say, yes, we've got to investigate what took place, because the Intelligence Committee has already released reports, public, non-classified reports, that it was a fact that Russia was involved in undermining these elections and on the side of one candidate, Donald Trump, versus another. So that's a clear fact. But now when you look at what Flynn has been doing, when you look at Tillerson, when you look at the cabinet officials, when you look at the connections, all these people have to oil and to Russia, and this is mind-boggling. And so we have to have this independent investigation and unravel what has taken place so the public can determine what to do next. But I think what's important now is transparency, investigations, and make sure this Russia piece is put together, because believe you me, we're at a dangerous moment, a defining moment. And efforts to undermine our democracy are being made right now. And also on the Affordable Care Act, what you can do to help me is to continue to help with grassroots organizing. We're having town meetings, we're having political town meetings where we'll talk about what we're doing on the political front. We're having issue town meetings. Help us, especially students and academics, come to the community and really be part of these movements that are taking place now, because I am very excited, really, in spite of how horrible things are with this administration, to see young people, to see people understand what intersectionality is in terms of how that works, okay? We've known for a long time what it is, but I mean, the Women's March was a clear example of how millions and millions of people could be organized around intersectionality. Yeah, I care about reproductive rights. You know, I may not be into criminal justice reform, but that's okay. You know, let's work together. Or yeah, I'm a labor union brother or sister, and I'm not into the whole reproductive rights issue, but we all have some connection there. And you know, just using intersectionality and explaining it to people and using that as a mode for organizing and educating, I think is really how we're going to change this country.
Are there any community meetings, for example, this week that you want to tell people in the audience about?
Lord, I had one this morning, one yesterday. I think I'm done for this week, but on March 25th, and I believe it's at Laney College, we're having a political town meeting. Is it still on the 25th at Laney? Yeah. So stay tuned. If any of you would like to attend, feel free to get in touch with us and we'll let you know. But it's going to be, what do we do now? How do we move forward? Where do we go? How do we, you know, do the politics that we need to do?
One question is long, and I'm just going to read one part of it. And the question is all hope lost?
No, wait a minute. Denise, again, I was born and raised in El Paso, Texas. I couldn't go to public schools. My father was a lieutenant colonel in the Army, so we couldn't go to restaurants and eat. We couldn't go to the theater. We lived in a segregated country. When you look at what happened in the South, I just came back from Birmingham, Selma, and Montgomery, taking young people to understand the civil rights movement. 4 little girls were terrorized and bombed at 16th Street Baptist Church in Atlanta. Bull Connor turned the dogs on to all these kids. Young people led a movement. John Lewis almost got killed fighting for voting rights. Sojourner Truth, Fannie Lou Hamer, Ida B. Wells, you know, no, we can't get tired or give up hope. Heavens no. No way. No way. No. And see, I just have to say, look at the movements that have taken place for justice in this country. And you look at people who paid the price, who spilled their blood, who fought so hard just for a woman's right to choose. You look at the people who fought for generations just to end slavery. I mean, it's like, no way. We may have gotten upset for a day or two after the election, you know, or some people are still depressed. I say, wait a minute. You know, when fear, because everyone's afraid now, and going back to my psychiatric social work training, when fear settles in, you know, anyone can take over, and the country becomes very dangerous. You know, with regard to the notion of scaring people and fear, and so we have to get up and keep fighting, because that's the only way we're going to beat back this un-American agenda of the Trump administration and move forward.
So there's several questions that are sort of the same. What can we do to ensure that wealthy Americans pay their fair share and protect seniors, the working class, communities of color, and immigrants?
Yeah. Well, thank you for that question. And you know, tax reform may come up under this administration and Paul Ryan. And tax reform is going to be providing more tax cuts for the wealthy and the corporate sector, and cutting benefits and increasing the military budget. So that's what we're dealing with right now. And so what we have to do, again, this is not a good time for what is taking place in terms of votes in Washington to stop this agenda. But I think we can hold them back on some of this. And right now we're saying, get money out of politics. We need to, you know, stop the hidden money that's going into politics. So we're trying to make some progress on public funding of campaigns. But we've got to make sure that the Affordable Care Act is not repealed, because that will end Medicaid, the most vulnerable people in the country, Medi-Cal here. We've got to keep fighting against repeal of the ACA, and we've got to tell this administration and members of Congress that $54 billion increase in the defense budget and another $30 billion in they call it the OCO account, Overseas Contingency Account, which is a slush fund, that's unacceptable. Because where is that coming from? It's coming from HUD. Secretary Carson has now put forth $6 billion in cuts.
cut out community development block grants. Where are these resources coming from? They're coming directly from the most vulnerable. There's no way a $54 billion plus $30 billion increase in the military budget helps with our national security. That's about military contractors. That's about engaging in wars that haven't been authorized. Last week, actually, I introduced a resolution to stop the funding for ground troops going into Syria, So we've got to, be bold.
Yeah.
Be bold. Because with their tax reform package, with their proposed cuts, and with their proposed increase in the military, this country is going to be in shambles in terms of the most vulnerable. And so now's the time, if ever, to hit the streets and to say no to this agenda and to engage with others, to tell their members of Congress, and in no way should you go along with this madness.
There are also several questions that ask about immigrants. So one states the ACA helped expand health care to some of the most vulnerable populations. However, immigrants and specifically undocumented populations remain ineligible. How can we ensure that all humans have access to health care?
And that's a very good question, and thank God California, in its wisdom, provides health care to undocumented immigrants. The state does, and also our community clinics and our healthcare system. The rest of the country, depending on their states, don't. And we could not get that into, and that was a big fight we had with the Affordable Care Act, but we just couldn't get the votes, even from some of our own folks, to do that. And it was a shame and disgrace how that went down. But only to say that, once we stop this repeal, there are a few fixes. That's one of them. And here in California, though, you have to be really happy of the fact that here in California, we do provide healthcare services to everybody. And tell your state officials thank you, because they really worked hard for that.
There's some questions about what we can do in the Bay Area related to environmental racism, which also relates to questions about how does gentrification affect health equity, and what can we do in relation to that?
Well, we stopped the coal from coming through. That was because people organized and stopped it. Coming through West Oakland, that was outrageous to have that kind of a even thought proposal that we had to fight to stop. Environmental justice is a big issue. Now, they're trying to get rid of the EPA. They're trying to dismantle the EPA. As Steve Bannon, who I'm trying to say get him off the National Security Council, has said, and I have legislation to do that. 70-some members have signed it. But bottom line is they're putting in people like over at EPA who want to dismantle the entire agency. They want to, as Bannon said, deconstruct the administrative state. Okay? So what program is going first? What department? They've already said they were dismantling the Office of Environmental Justice. In fact, the young man who headed it, he resigned. He was not going to tolerate it. And so we, at the local level, have got to continue to look at different communities, make sure that we have companies, if they're going to site in low-income communities, that the community knows and that they pass environmental tests and don't dump toxic pollutants in the, we're still cleaning up from oil spills and dirt with oil in it in West Oakland. And so we have to make sure the private sector, when they come in, that the community knows and that we vet them very carefully in terms of what they're doing. Because the EPA is not going to do it until this administration is gone, which we're working on.
There are too many good questions, and we only have 5 minutes.
This is Cal.
So if I can, I sort of want to ask 3 questions together. One is, there are several people who asked something about, in this age of extremism, what is your approach and what are good approaches to negotiating with those across the aisle? How would today's discussion be different with a more hostile audience? How would you talk with them? Which relates to another question. Many of the citizens who benefit most from the ACA are also strongly opposed to it. How do we remove negative connotations from quote-unquote Obamacare among these communities? And then the last one that I'll pretend is related. As people involved in the university, we trade and research facts and truth. We do research, produce facts, and deal with truth. What type of research do your colleagues on both sides of the aisle need at this time?
What type of research do my colleagues need at this time? I think what they need, and on our side, we're convinced, but they need to hear more about climate change. I had an event this morning with Congressman Jerry McNerney, who's a scientist, PhD in math. And I think the research on climate change and the fact that the planet is getting warmer and the glaciers are melting and, you know, all of the research that's been done on climate change, I think that would, you know, the more we have, the more ammunition we have to fight those that don't believe in science, which there are many. There are many. And so on the, if this were an office, a forum of, I won't say hostile people, but people who didn't understand how you understand the facts about health equity, put politely, trying to, I would say the same thing, and they would be yelling and screaming at me, and I wouldn't yell and scream back, but I would give them the facts, and that goes to one of the questions about the people who have benefited from the ACA. The studies have been done now to show that the majority of people who will lose under repeal of ACA are Donald Trump voters, okay? Donald Trump voters. So I would explain that to them. I would have my facts and figures and I would know who they are and I would kind of lay it out. If I were in West Virginia, just like, you know, recently a man came forward and who voted for Donald Trump and said, I didn't realize I would lose my coverage. I have black lung disease and I never had coverage before. I say, yes, sir. That was the Affordable Care Act. You mean Obamacare? Affordable Care Act, you're covered now. Well, I didn't know that. Okay, and so I think to explain the facts, I mean, it's true. Black lung disease was not covered before the Affordable Care Act. We put in a provision to cover people suffering from black lung disease. They did not know that in West Virginia. So I would try to calmly explain what this was about. And hopefully some would hear me and some probably wouldn't. But I think it's important to know that where I have an opportunity to try to explain the facts, I do. And with regard to working with the other side, well, I'm gonna give you one example. A lot of Republicans right now on the other side are just shaking their head. They're not coming forward, not yet, but I think on Russia we may see some come forward, okay? And just kind of shake their head. But they haven't had the, yet, courage to come out and say this is wrong what's taking place. Sooner or later I think they will. But in the meantime, I think all of us know who we can work with. And I'm gonna give you one example. I had the legislation that established the Global Fund for HIV and AIDS and PEPFAR, the President's initiative that Bush signed into law. Well, those were my initiatives. I wrote those bills, had bipartisan support. And of course now with this 45th president trying to 45. He put up a proposal to cut the foreign aid budget by 37%. Now, people think that we contribute 25% to foreign aid. It's less than 1% of GDP, okay? And so I went to my friend, Ileana Ross-Layton, who's a Republican, staunch Republican, and I said, Ileana, we've got to do something because her district is very clear. She represents parts of Florida, Key West, on HIV and AIDS, and I established the bipartisan HIV/AIDS caucus. I've got 80-some members and quite a few Republicans. So I went to Ileana, I said, look, your president is getting ready to do something. You can't do it. This has been bipartisan since 1998, 99, when Bush came in, we worked together. And so last week, we did a long letter signed by myself and Ileana to 45 and said to him, don't cut the AIDS budget. And we gave him the reason. Rather than cut it, you should increase the funding because we know we can achieve an AIDS-free generation by 2030. We just know that. So we sent a letter together Bill Frist wrote an article, a Republican who helped us on the bill. In the New York Times, I wrote a letter commending him. The New York Times published it. So, you know, on different issues, I think we find bipartisan cooperation, but they're not coming forward yet en masse to say, you know, this administration has got to stop what it's doing because it's hurting the most vulnerable. It's damaging our democracy. It's really moving us in a direction in terms of the creation of a country of the military and the corporate sector, period, ... in terms of this construction of the administrative state. So we need more people to understand what's taking place. And they haven't gotten there yet, but I think they will.
Mm-hmm. You want 30 seconds for any last words?
No, that's it.
Okay.
So thank you.